My dear students, today's our topic is substance induced disorders. See, why we need to know about substance induced disorders, what is the substances, various types of substances, and what is the impact of human life and how it is going to impact of psychological disturbances. Today let us go about it. Substance abuse is refers to the harmful and hazardous use of psychiatric and psychosubstance use. It includes alcohol and illicit drugs. Today in the society, the lot of varieties of drugs are available. Due to the illicit drugs, which is causing of lot of health issues and social complications and social problems. One of the key important of illicit drug use is society's negative health consequences. There are a lot of teenagers, especially 14 to 40 years people are more prone for these problems. Drug use also put a heavy financial burden to the nation, the individual and family and the society. Today, substances are very widely available in the market, though it is a lot of legally offensive, but it is illegally there people are getting into the problems. Let us know the definition of substances. Substance is the continuance of alcohol or illegal drugs or misuse of prescriptions of overdoses of drugs which considered by substance use. See, those who are taking substances, maybe we are also taking medications for the various health conditions, maybe that is the prescribed by the doctor. As for the rules, we have to take the as for the procedure of the doctor, but people are taking haphazardly and overdoses. The overdoses also can consequences lot of health issues. There are many things which are involving in the problems. See, the people those who are taking drugs and it is disturbing their work life, and those who are students, those who are taking and having a habit of alcoholic use, it is impacting of their education system. They are not attending regular schools and they are having a problem at home and they are having a problem with interpersonal relationship in the families. Problems not only within the family, it is also causing for society and it is leading for various law and health problems. What are the physiological risk factors which is very dangerous today? If you see that people are getting cardiac arrest, people are getting strokes, or people are having various chronic physical illnesses due to the substance use disorders. You know that I am just trying to give you some of the important drugs which is available in the market, which is very harmful to the human body: alcohol, cannabis, opiates, cocaine, amphetamine type of stimulants, sedatives, inhalants, hallucinations. See, these are the drugs which are using as for illegal, as is against to the law. People are using these drugs, and due to these drugs there are lot of things are happening in the society. See, why substance use problems are very important in the society. Why we need to know substance and what is related psychological and physiological complications. Today, if you see that the harmful use of alcohol and excessive use of alcohol, it resulting of 3.3 million people are getting death in the year, and average every person in the world age 15 to 60 years, they are getting 6.2 liters for annum average. The overall population is see, people are taking some people, but if you put into the overall population 6.2 liters every people are drinking alcohol. See, you know something, the people are those who are taking alcohol have a lot of consequences of physiological and mental health, and it causing of social health. And if you know that there is a lot of things happening within our Indian context also. See, I am giving this bare facts is as for the WHO guidelines. If you see that according to National Drug Dependence Treatment Center in India and along with the AIIMS, All India Institute of Medical Science, collaboratively done a research on Indian population and in India, various states, various districts, various villages, the survey, and the help of the Minister of Social Justice and Empowerment. See, the survey was being conducted by AIIMS, and that survey facts are, this is the complete household survey. There is a team of the mental health professionals are visited house to house and done the survey, and the age group between 10 to 75 years, and 36 states and union territories are included in this survey, and they found that there are national level the total there are 2,111 households are visited. In 186 districts, total 4,73,569 people are entered. In the overall this sample are found that 123 districts, 70,293 people are suffering from alcoholic dependency. Not only alcohol, the drug dependency, and it required immediate attention and treatment in the hospitalized. If you know that highest drug dependency in India, alcohol, 14.6% of the population having alcoholic dependency. Dependency means where people required special attention by the mental health professionals. Approximately 16 crore population have more prevalent towards the alcohol, or 17 times more men rather than the women. Cannabis use 2.8%. Approximately 3.1 crore people are suffering with the cannabis dependency. Opioid, heroin, cocaine like stimulants, there are 60 lakhs people are dependence level, they required hospitalization and treatment. And sedatives, inhalants, 1.08% means 1.18 crore population are suffering with the dependency. Cocaine 1.10, see amitriptyline and stimulants, hallucinations, like it also follows the other cocaine type of drugs. See that overall 10 years to 75 years old people in India are suffering with alcoholic or substance dependency. Today it is a very prevalence and incidence. Why we need to know about substance and substance related problem? See, in the overall this survey are found that there is various substances are found. According to Diagnostic Statistical Manual 5th edition, text revised, according to that there is 10 important classifications of drugs are available in the market: alcohol, hallucinations, caffeine, cannabis, inhalants, opioids, sedatives, hypnotics, anxiolytics, tobacco, stimulants, is like cocaine, heroin, like substances are available. These are the highest prevailing substance use problems are according to DSM-5. See, some people have lower level of self control that predispose the development of the problem. You know something, people very just simply says that there are a lot of people are drinking alcohol, lot of people are having habit of various chewing gums, various side of cannabis. What is happening to me? See, my dears, let's think about each and every body is differs. See, one body has more resistance than other body. See, some people can have more resistance to impact of the problem. Some other people have less impact. See, that is the reason substance related disorders, like you can see that substance use disorders, substance induced disorders. See, what is the disorders comes under the substance use disorder? See, when we say the substance use disorder, it is a pattern of symptoms resulting from the use of substance that you continue to take despite experiencing problem as a result. When you are having a substance, the substance give you some sort of alarming state to have frequently having a consumption. There is a substance induced. Due to the substance, you are having some sort of physiological resistance level increases. For example, today you are 1 month you are having quarter means 90 ml or 120 ml alcohol or substance, and after a week or after a month your intoxication level increases, because if you getting kick you require more doses of the alcohol or substances. See, that is the increasing of intoxication, because substance induces it is increasing of your resistance level. Slowly it goes to the, if you are not taking alcohol on particular time and if you delay taking of alcohol or substances, you have some sort of withdrawal, tremors, hesitation, anger outbursts, restlessness, such type of things can be presented. It can lead for various mental disorders. That condition considered to be substance induced disorder. Okay. If you look into this table, you can see there are a lot of symptoms when we can say substance use disorder and when we can say the substance induced disorders. If you consider within the 3 symptoms are present within your behavior that considered to be use disorder, more than 4 symptoms are presented that considered to be induced disorder. See, taking a substance is a larger amount for longer than you mean to. See, you are, for example, first time you are taken a 90 ml, next time you are a week or 2 weeks or 3 weeks, the 90 ml is not sufficient to have a kick, and that required more amount of the alcohol, that is means that you are using towards the substances. And taking another thing is spending a lot of time getting using or recovering from the substances. See, to coming out from that dependence level, you require a lot of time, and day to day it is increasing of your craving and adjust, and not able to manage your day to day life activities, work, and not able to supervise your home responsibilities, not able to follow your school curriculums or college curriculums. That can be due to the substances. That is also one of the important symptoms. When you crosses the symptom of 4th, then you are being in the dependence level, and your continuous use of alcohol, and it is going to influence of your interpersonal relationship problems. And you can something apart from that, if you go again taking more alcohol regularly, and it is going to cause you your occupational disturbances. Maybe for example, yesterday night you have heavy doses of alcohol with your friends with the party, and that day morning you have a hangover and you are not able to be awake on time and not able to attend your duties, because your occupational disturbance can increases and is going to lead for a lot of financial problem. And using of alcohol can people get into the very quick aging. Okay, people become older than those who are not taking alcohol, and continuous taking alcohol can have a lot of psychological problems. Today if you see the lot of marital conflicts between a husband and wife, those are having alcoholic dependency, that person cannot have a good family relationship, a physical intimacy between the partners. There the person is having more craving and imagination thoughts in the mind, those who are alcoholics, and when the partner, then they have an intimacy relationship, they are not sufficiently fulfilling their needs, and they have some sort of conflict and inferiority that can lead for the suspiciousness about the partner. The suspiciousness can cause for interpersonal conflicts between the husband and wife. See, today lot of paranoia or delusional disorder or having some sort of diverse due to the alcoholic intoxication, and it leading of interpersonal conflicts. And also see that there is 3 levels of alcoholic use. One is alcoholic use, abuse, alcoholic dependency, and alcoholic addiction. Alcoholic use, a person drink alcohol when a social occasion, a social things are comes, some family functions or some functions comes, you just have with the friends just as a 90 ml, it is very formal. But a person who is a dependence regularly every time timely is drinking, and addiction without alcohol he cannot do his daily activities. That is the 3 levels of alcoholic abuse, alcoholic dependence, alcoholic addiction. Those who are alcoholic dependence and alcoholic addictions are the problematic people, those their physical health, their psychological health, and social health. These are the things which we just simply can be classified. Based on the severity, how we can differentiate substance use disorders? According to DSM-5, there are 3 levels we can see: mild, moderate, severe. Just before I presented the table, in the table 2 or 3 symptoms indicates that you are in a mild substance use disorder condition. And if you see that previous slides, more than 4 or 5 symptoms are indicating and you are observing your behavior, that consider your moderate substance use condition. And if you see more than 6 symptoms are presented in the table, that considered to be your severe substance dependence. That is the reason I just like to tell you, all of you, see, understand what is alcoholism. See, alcoholism has the behavior. So, human has the behavior, alcohol has the behavior, and everyone has the behavior. But what is the alcohol has the behavior? See, the men or women will go and have a drink. First we will go and have a drink. Then Once you take a drink, the drink will take a drink. Then finally the drink will take you. The drink will take you. What it means? See, very simple example in the public what the notions is going on. See, a rickshawala says that, see, the morning to evening I was very hard work, I struggled to survive my life to earn money, and evening at 6 o'clock or 7 o'clock or 8 o'clock I was just fed up and so much of body pains, I just want a relief, just a peg or a 90 ml. You will go and have a 90 ml alcohol. So, what happened, once he taken alcohol of 90 ml, after 15 minutes to 20 minutes he triggered to have another 90 ml, and finally he took quarter and just wants to, he expecting that this wife is going to scold him because he is having a habit of alcohol. Then to face that consequence of the future, he will have another 90 ml and is taking more than a quarter 90, and finally he is come to the with the intoxication state at home. Again the quarrels happens, the wife scold him and he also face the emotional turmoil at home. Then again he will have some guilt feeling, again tomorrow the same thing happen, it repeats. So, what happen, first you will go and have a drink for your own pains and relief, then drink is taking another drink, finally drinking, without drink you cannot survive, you cannot work. That is the nature and behavior of the alcohol. Let us see that, see, substance induced disorders basically according to DSM 5, Diagnostic Statistical Manual 5 text revised, says the substance induced mental disorders are there. So, based on the intoxication level and based on the features of withdrawal, we try to understand the various conditions of the. See, what are the mental and behavioral disorders we found due to the substance use? We see these various mental disorders we are finding due to the substance use disorder. Those who are substance dependency level, those who are intoxication level is high, those who are having a withdrawal symptoms can see in various mental disorders. There are psychotic disorder, bipolar related disorders, depressive disorder, obsessive compulsive related disorders, anxiety disorder, sleep disorder, sexual dysfunction disorder, delirium and neurocognitive disorders. See, these are the very familiar, broadly understandable psychological condition due to the substance induced conditions. Okay. So, what is a psychotic disorder? One second please. What is the psychotic disorders? See, those who are not able to understand what is the consequences happening in front of him, means that there is poor touch with the reality, he is not able to understand what is his thought, what is his behavior, what is his society. When he is not able to collaborate his thought, behavior and social consequences, such things we consider to be psychotic disorder. Means those who are having poor touch with the reality, not able to collaborate and adjust in the society, such condition psychotic disorder. How it comes? Due to the continuity of substance use disorder can have psychotic condition. So, bipolar related disorders. So, what is a bipolar? Bipolar disorder is one of the mood disorder. Those who are having one episode of mania, one episode of depression, and those successful complete of mania and depression, and next episode is considered to be a bipolar affective disorder. See, what is a bipolar affective disorder? Those who are substance induced substance dependence people can have a bipolar affective disorder. See, these people have excessive talk, over familiarity and grandiosity. They can talk, they feel that they can do anything in the society and they are grandiosity about themselves. They can say lot of things which they are not at all eligible to do it, tell about it, such things they can talk. Over familiarity, they will talk it anyone without any nearness, any familiarity. They just talk excessively and they have euphoric mood, they can laugh biggerly. See, they have elevated type of behavior, such condition considered to be bipolar affective disorder. Suddenly sometime they cry. Bipolar means it is not only manic symptoms, they can also see in the depressive symptoms like they cry, they feel, they guilt about it, and sometimes they do not want to live in the life, they want to disappear. Such type of condition considered to be bipolar affective disorder, that is also more prone for the substance use disorders. So, another condition is a depressive disorder. If you look into the most of the suicides in the society, who is committing suicide? Those who are committing suicide and we can see the majority of the people under the intoxication they are committing suicide, means they are taking an alcohol or drugs, and in the drugs intoxication they are committing suicide. See, depression is a in the depression is suicide is one of the important component. Suicide, hopelessness, worthlessness, helplessness, and feeling of lethargy, not being capable, such type of symptoms can also see those who are alcoholic substance used people, those can see in the depressive condition. Obsessive compulsive disorder, what is mean by obsessive compulsive disorder? How it could be the in substance use disorders? Those who are having alcohol or substance dependency, they can have over cleanliness, over possessiveness, over perfectionism, and they are very irritable. They are very functional, they want things to be according to that. If their things are not according to the place, they get irritable and they get anger, they try to throw the objects. See, that is considered to be obsessive compulsive disorder. Sometimes it could be their personality also. Anxiety disorders, those who are substance dependency people, they have tremors, sweating, tachycardia, or uneasiness and drying mouth. All these things can also be seen in the those who are having substance dependency, and anxiety symptoms also in presented. And also there is another important sleep disorder. There are people, those who are taking stimulants, comparatively sedatives. Sedatives means alcohol is a sedative. After taking alcohol, you are supposed to get a sleep, okay, is a sedative. Like stimulant, there are various opiates are there, heroin is there, cocaine is there, the inhalants are there. These are the stimulants, it will give you lot of excitement, you won't get sleep. Getting into sleep is difficult for those who are having alcohol, various substances. And I just told you that sexual dysfunction, basically those who are substance used people, those who are taking drugs, they have lot of desires, not the functions. They get lot of desire, they have lot of enthusiasm in the thought level. When they comes to the functional level, they are not capable to perform the sexual function according to the respected manner. That is the reason most of the partners dissatisfaction during the intoxication state and does the sexual act, and they are not able to perform with the partner. The partner also feel it is very bad and very unhappy, and that can affect the interpersonal relationship between the partners, that can lead for the sexual dysfunction. Not only that, and premature ejaculation very predominantly identified, sedatives like sedatives involving in the sexual functioning. Delirium, they have a lot of memory disturbances, and there are some sort of, like if you know something during the COVID time, there are like most of the beverages, wine shops are closed. After a week, there are lot of people are get withdrawal symptoms, and due to the withdrawal symptoms, if they are not appropriately treated, they have some lot of neurological problems, delirium, they get into the delirium, okay, the forgetfulness, agitative mode, they have forgetting the identity, such type of behavior can be presented, okay. And also we see substance dependence disorders, like if you take 360 raw alcohol without any mixing of any water or any cold drink, if you take an alcohol 360 ml, it lead for lot of cognitive deterioration in your brain, and neurocognitive changes like course of conditions can also happen. These are the various psychological disorders due to the substance disorders. You can also the intoxication. So, intoxication, substance intoxication, a group of substance induces disorder, detail the symptoms as people experiences when they are under the influence of the drug. Like you can see the intoxication includes marijuana intoxication, cocaine intoxication, methamphetamine intoxication is a stimulant, heroin intoxication, and there is various acids, hallucinations, like something, the smoke of a bike can also be give you intoxication, and also that it can lead for lot of delirium and all the things. Those who are taking alcohol, which they are not continuing the regular taking alcohol, they can have withdrawal. Withdrawal involves experiencing physical, cognitive and behavioral symptoms due to the reducing or altering substance use. Means if you stop regular taking alcohol or substances, it can alter your behavior, it can alter your cognition, it can alter your physical conditions. That is the reason withdrawal is very dangerous if you are not appropriately identified and taken treatment. To be diagnosed with the withdrawal, these symptoms must not be due to the another medical condition. Please careful enough to understanding whether the conditions are due to the substances or any other medical conditions. Withdrawal from some substances like alcohol or barbiturates or can be like life threatening. See that in COVID time also there are lot of people are gone into withdrawal, and some people are died due to the not able to take appropriate treatment from the medical professionals. Yes, these are the various things which we try to understand. Okay, let us see that how to diagnosing substance abuse disorders. See, substances use disorders should be evaluated by the psychiatrist, psychologist and licensed counselor specialized in the drug and alcohol addictions, and health professionals may be utilizing using the blood and urine examination. From there we can try to understand whether the person has the drug use or not. However, it is important to that there is a like lab test and to establish dependence. See, there are some psychological tests are available that is going to helpful to the to understand what is the state it is. And there are some questions because the psychologists need to be understand problems of the substance used people. The problem drinking make more mental health issues, and people are very less, see those who are taking alcohol they are less prone to take medication or treatment from the health professionals, and they will not visit the primary care health centers, and it is a they will not consider it as a ill health. Alcoholic related problems often go unrecognized in the especially in hospitals also. People do not recognize that the fellow has the withdrawal symptoms due to the alcoholic use, and it required lot of knowledge in the society. See, what is the reasons for understanding recognition of alcohol related problems? Lack of education, the society is not having proper education about various substances and it related problems and behaviors, and negative attitude towards about alcoholism. People those who are alcoholics, we have negative attitude, this fellow is like this, and we are just pessimism about treatment. This what is there, nothing is there. See, who is going to change me, like nobody will change me, such type of things are there in your thinking that can cause for not taking medication. Discomfort with related social issues, and if you go and consult the psychiatrist or clinical psychologist or psychologist for their health alcoholic related problems, and you can have some stigma from society, that is also another problem. You are not consulting and taking medication for it. See, ask, assess and monitor the what are the things. First step 1 is ask about alcoholics. See, any psychologist or counselor or medical professionals, please ask about frankly whether the person has any alcoholic use or not. Step 2 is assess for alcoholic related problems. Due to the alcohol, what are the changes taken place in the bodily and psychosocially. And step 3 is advise appropriate actions, and to give you brief intervention. Try to counsel him, try to explain him, try to guide him and try to monitor the things, and also that how much alcohol he is drinking and how much things is appropriate should screen by the expert. See, those who are alcoholic counselors, see these are the common drugs which are also going to be alcohol and cannabis, opiate. Common drink patterns, these are the like high risk, low risk, abstinence, binge drinking. Like there are like standard drinking behavior, this is the people 30 ml spirit which can easily recognizable. It is one way we can legally make use of it. Okay. See, how to judge, how to listen, how to make the people. When we talking about alcoholics, we should take a screening questionnaire. The case is available in the online. All psychologists get the case questionnaire and go through that. In the case questionnaire, if you see the more than 4 questions are answered yes, and let go ahead it. And what is the things you need to be? What is you have to motivate the people to motivation enhancement therapeutic intervention, which is a more appropriate intervention to minimize the alcoholic dependency. See, first important thing is readiness. See, how is the readiness? See, you should take the people the importance of his life and his health and his consequences, and it should be confidence. See, then this can be pre-contemplation, preparation is important method which we need to push to make the intervention for the alcoholic people. Okay, these are the techniques which we use for minimizing of alcoholic dependency, and you can see that there is a lot of signs, physical signs also we can see that red form. These are the things we can see that lot of alcoholic related problems. What are the gastrointestinal symptoms we can see, and the liver problems we can see, and we can see the cirrhosis can see, and pancreatitis can also see that how the changes can happen, and we can see that the heart problem, cardiovascular disorders can seen, and see people those who are taking nutritional deficiencies can cause due to the alcoholic use, and you had immune response also can come down because the wound can takes a lot of time to recover, and it can easy to those who are alcoholic substance can use for HIV because they do not have the consequences during intoxication, sexual disorders, skin diseases, psoriasis, eczema, scars, and also neuropsychiatric like delirium, hallucinations, paranoid tendencies. Most of the things can seen in the people those who are alcoholics. See that neuropsychiatric manifestations, cardiovascular problems, and also having liver functions. These are functions are the responsible. Let understand, let help the people forever. Thank you.